tuning in into this special episode of the PSJA Family Podcast, Voices of PSJA series in honor of Mental Health Month. My name is Sulema Solis, Director of Health Services. Joining me today are fellow colleagues that play a key role in promoting mental health and safety for students and staff in our district. Thank you for joining us. Will you two please introduce yourselves with your names, titles, and years of experience?
Good morning, PSJA. My name is Gina Saenz, and I'm the Director of Counseling and Guidance, and I've been with the district for 22 years.
Welcome. Good morning, everybody. My name is Rolando Garcia. I'm the new Chief of Police for PSJA ISD. This June will be my first year with the district, but I've been in law enforcement for 27 years.
Thank you. Thank you, Ms. Saenz and Chief Garcia. With COVID-19 pandemic affecting everyday lives, today, we're going to talk about some of the behind-the-scenes efforts PSJA ISD has taken to raise awareness about mental health among students and staff. So what are some of the ways the pandemic has challenged our PSJA family, and what productive steps has our district taken to help us cope and adapt to this situation?
I could speak on the law enforcement side, Sulema. Just when we were in class and on campus, we were able to have that interaction with our students, with our staff, and making sure that there's that connection between us and have some sort of contact. But now with the COVID-19, it's a lot different to where we're doing a lot of remote stuff. But at the same time, we want to make sure that we're visible in the streets and, trying to make contact with the public as much as we can by shifting some of our patrol tactics.
Thank you, Chief.
Mm-hmm. And I just want to share that with the counseling department, our services have stayed the same, but we've transformed all those services into virtual. So with communications, we're very fortunate that our technology department, Dr. Ardavalos and his team, they set up the counselors with a system called Cisco Jabber, and that's a two-way communication. So the counselors are able to call the students and call the parents, and then they're able to reach back to them and through the campus phone number and through the extension. So communication has stayed the same. The counselors have also provided still guidance lessons. So instead of going into the classrooms, they're posting them on Google Classroom. And then we also posted those mental health guidance lessons on reference to anxiety, depression, stress management. We also created a folder and we placed those lessons on the e-learning hub. And then we also created another folder for our parent resources. So there was two folders created. And then with the individual counseling, the counselors are still providing individual counseling. The referral forms, like of an administrator or of a teacher, or if a parent is requesting counseling services, the counselors are still providing that. If the counselors feel, and once they're talking to the students, that they have like some mental issues or some situations that they need more professional help, then the counselors are seeking out outside with mental health professionals to help them. Like they'll reach out to our outside agencies that we have partnerships with, which would be Texas Tropical Behavioral Health or telehealth program. We also have real close partnerships with Palacios Counseling Center, Palmer Drug Abuse. So we're still using those same outside agencies. And then we're still providing the students crisis support. So if any student, if they have a death in their family right now, or if they're having, just thoughts that they don't want to live, or if there was an accident, a car accident or something in their family, the crisis support is there for them as well.
That's fantastic. That's fantastic. Chief, can you also give us a little input of how you work together with the counseling department, with health services, and how our three departments work together when we do have a crisis or we're made aware of a crisis? Can you talk a little bit about that, Chief?
Right. So our intervention team, and I was about to touch up with what Ms. Saenz said, our intervention team works hand in hand. it worked hand in hand when we were on campus, but now even more so because we're a phone call away to where, my officers are out on the road 24 hours, 7 days a week. So if we get a call at 3 a.m, they're calling me or they call the teacher or a counselor, I can send one of our officers from the district to go out there and immediately, make contact and evaluate and assess and see what we need to do for that student or even the parent. But all three of us have always worked hand in hand. It's a great partnership that we have. We all have our roles, but at the same time, our support system for all of us within the three departments is really what makes us a very, very good cohesive unit that really has the best interest of our students and the district at heart.
I agree. We're a great team. I know that when our nurses have made contact with students, families affected by COVID, I reached out to your team. I reached out to Ms. Science team, and you all have made efforts to try to provide emotional, social support for those families. You've also had your team go out of your way to provide hot meals, since we've had some hot meals donated. You all also were instrumental in getting the meal distribution as safe as possible to provide that needed support during this stressful time, because if it's financial struggles that they're enduring, we're trying to help the best we can as a district. So I really appreciate all of y'all's help. And you did, I also wanted to say, Gina, can you talk to us a little bit about the PSJ Employee Wellness Series that we have going on through health services and counseling services and communications department?
Yes, we're really excited about that because the counselors, we're here to support our students and we're here to support our parents and our families, but also our employees. So there's different services that we have for our employees, that we have counseling for our employees, but then also how you mentioned, this is a new initiative when the coronavirus outbreak came about. We felt that we wanted to create this initiative called the Emotional and Wellness Webinar Series. So my counselors, together with the nurses, Sulema, your nurses, and then also our wellness coordinator, we've created these videos to help our employees just, feel relaxed and, meditate on one of the days. On Mondays, it's called Meditation Monday. So the counselors have provided some breathing techniques, 4-7-8 technique, how to breathe. And then on Tuesdays, it's Tasty Tuesday. So they've also shared some of their famous, easy to do recipes like no-bake strawberry pies and banana splits and so forth. And they look very yummy. So we hope that, the employees are really appreciating the different recipes that the counselors have been sharing. And on one of the days on Wednesdays, it's called Wellness Wednesday. And on Thursdays, the videos that we share are Thankful Thursday. So the counselors have shared a lot of different activities on gratitude journaling or gratitude jar. And these are just activities, again, so that the employees can feel and just relax and, enjoy these activities with their families.
Thank you. I know I myself have enjoyed them, and I've enjoyed the recipes. I haven't tried too many of them, but yes, I'm really appreciative of all our staff that has put a lot of effort into those wellness series and continues to do so. You mentioned a few of the resources, Ms. Science, that are available for our families and staff seeking support for health. Chief, did you want to add some? And then maybe Ms. Science can also just tell us again about some of the resources available for our families and staff.
So now that we're conducting 24-hour operations, we do have somebody that's behind a desk, answering the radios, answering our phone calls. So if anybody from the community needs just somebody to talk to or needs to speak to an officer regarding any issue, regardless if it's mental health or not, they can call us at 956-354-2175. And if they need help, we'll go out and do whatever we need to do to get them and their problem resolved and situated. But in speaking with Gina, those same, Texas Tropical, South Texas, we have our contacts there as well. And, if they can't get a hold of the counselors or teachers, they can call us at that number and we can get the ball rolling on our end and really, try to address it as quickly as possible.
Very good. Thank you so much. And I'd also like to mention our office is also open, health services office. So if you're having any COVID symptoms or stressed out about COVID, if we can help in any way, our nurses are all available also. And we also have someone in our office at all times, and the number is 8 to 5, and the number is 956-354-2016. And you can reach someone there, and we can make contact with a nurse if there's any stress or anxiety or any symptoms that you're worried about. We can help, and we can try to get you the help that you need. Ms. Sainz, did you want to add any additional resources for the families and staff?
Yeah, I just want to add, like I had mentioned, the counselors are providing individual counseling. We know right now at this time that the coronavirus outbreak, it's normal. We want to mention to, the students and to the parents that if the students are feeling, emotions and certain feelings, it's normal, it's understandable. But if it's affecting their life activities or their learning process, then that's when we ask that for you to seek out the counselors, and we can provide that individual counseling for your child. If we feel that it's a severe issue, then we will reach out to our outside agencies. We, like I mentioned, we also have a really close partnership with telehealth program where there's LPCs and psychologists and psychiatrists that that provide that counseling. We also have some wraparound services that if the families are going through and they need financial help through like sources for rent or utilities, they need clothing, they may need shelter, the counselors can also give you good help and assistance.
Can you provide us a contact, Ms. Sainz, or a website maybe where they can find these resources?
Well, they can reach the counselors at www.psgisd/counseling, and then we can give them those phone numbers, and that information, because it's going to vary from home to home. Some may need like help and assistance with rent, and some may need clothing. So we're really close with, and we have some partnerships with the Food Bank and Salvation Army. So, we have different phone numbers that we could provide. But if they seek out and they let us know what type of support they need, we're ready, available to help.
Thank you so much. Okay. Mm-hmm. And we also still have telemedicine services available as well. We started that a few years ago in conjunction with the behavioral health, the mental health services. So those are available through our website. You can find them on the PSJISD website under telemedicine services, and the links are also available there for mental health. So did you all want to add anything else? Any other closing remarks?
Just on behalf of the police department, we want to make sure that everybody's aware that we're out there for them. We're making sure that we're trying to maintain that visibility. We've been doing birthday parades for kids, for our students, just to make sure that they're still aware that we're out there and we're thinking about them. So just please reach out to us for whatever you need. We're more than happy to do that, just to get that smile on their face during these times.
That's wonderful, Chief. Ms. Sainz?
On behalf of the counselors, we just want to tell the students that we really miss them, and this is going to pass soon. And the only thing that, as a director of counselors, I want to let, the students and the parents know is that right now, just focus on the things that you can control. Make sure to take care of yourself physically and mentally, and what you say and what you do, those are things that you can control. Your sleep routines, make sure you get 7 to 9 hours. What you eat healthy, and just ask for help. If you need help, we're here. You're not alone.
Thank you. And on behalf of the nurses as well, I know they miss you. We're hoping that this too will all pass soon. And if you need us, you can reach us. Okay, so thank you all for joining me today. On behalf of our entire PSJ family, I thank you for your commitment to our district and community. Thank you to all the viewers. Thank you for listening. And remember, we're here for you, so don't hesitate to reach out to us. You can find us on Facebook at PSJ Counseling, at PSJ Health and at PSJ PD. Thank you and stay safe, PSJ family.